What is neutropenia from pancreatic cancer chemotherapy? Neutropenia is a medical condition where the body has an unusually low level of neutrophils, which are a type of white blood cell that plays a crucial role in fighting infections. For patients undergoing chemotherapy for pancreatic cancer, neutropenia can be a common side effect. This happens because chemotherapy drugs are designed to target rapidly dividing cells, which include both cancer cells and healthy cells in the bone marrow that produce neutrophils. When the production of these important cells is reduced, it can weaken the immune system, making patients more susceptible to infections. Chemotherapy regimens for pancreatic cancer, such as the combination of gemcitabine and nanoparticle albumin-bound paclitaxel, are effective treatments but can lead to severe neutropenia in many patients. Research indicates that more than half of the patients receiving this combination therapy may experience grade 3 or 4 neutropenia, which signifies a significant drop in neutrophil count. This level of neutropenia requires careful monitoring and sometimes adjustments to the treatment plan. The primary reason for neutropenia during chemotherapy is the damage that these drugs can cause to the bone marrow, which is responsible for producing neutrophils. Since chemotherapy affects fast-dividing cells, the bone marrow cells that create neutrophils are particularly vulnerable. As a result, patients may see a sudden or gradual decline in their neutrophil levels depending on various factors, including the specific treatment and individual patient characteristics. While neutropenia itself may not present noticeable symptoms, it can lead to serious complications if an infection occurs. Common signs that may indicate an infection include fever, weakness, sore throat, cough, difficulty breathing, painful urination, and diarrhea. Because neutropenia does not directly cause symptoms, both patients and healthcare providers need to be vigilant about monitoring for signs of infection. Certain factors can increase the likelihood of developing severe neutropenia during chemotherapy for pancreatic cancer. These include having low neutrophil counts before starting treatment, elevated bilirubin levels, and low levels of C-reactive protein. Interestingly, age alone is not necessarily a significant risk factor. Patients with these risk factors requiring close monitoring throughout their chemotherapy cycles to manage and mitigate any complications related to neutropenia. Managing neutropenia often involves several strategies. These may include adjusting the doses of chemotherapy, using growth factors like granulocyte colony stimulating factor to help stimulate the production of neutrophils, and promptly treating any infections that arise. It is essential to maintain pancreas health during chemotherapy by balancing effective cancer treatment with minimizing adverse effects like neutropenia. This approach helps preserve immune function and supports the overall well-being of the patient. In summary, neutropenia resulting from chemotherapy for pancreatic cancer is a reduction in infection-fighting neutrophils caused by the toxic effects of chemotherapy on bone marrow cells. It is a common side effect that requires proactive monitoring and management to ensure safe and effective cancer treatment. Always consult with healthcare professionals for personalized advice and treatment options.